My name is Andrea Aranda, and this is my informative speech for public speaking, the modern world of surgery. When people hear the word surgery, they think of plain white walls, people running around in masks, and surgeons wearing long white coats. But the modern world of surgery is so much more than these small details that people only know about from watching TV shows, and movies. The modern world of surgery is held together by the importance of sterility and why it's so necessary in these healthcare facilities. The main points of maintaining a sterile field, a sterile environment, are what I want to go into detail and raise awareness of why it's so necessary and important. Today I will be covering why it is important to have sterility in the operating room, and how sterility works within the hospital. So why is it so important to have sterility? Sterility is important because it helps ease patients' mind. It brings a peace of mind to the patients and their families and their loved ones or anybody entering a healthcare facility. Not only them, but also to the doctors, to all the personnel that work in these hospitals, in these healthcare facilities, as they all rely on each other, on their expertise to keep a clean and sterile environment for each other. And according to the Association of Sterile Technologists, every hospital follows a step-by-step protocol in keeping their hospital clean and maintaining a sterile field, which is very important, especially in the operating room, where a sterile field has to be maintained for hours on end, and if anything disrupts the sterile field, the operation has to stop. Nothing can start in an operating room if it is unsterile. But how does sterility work in the operating room? When in a hospital, the effectiveness of sterilization is based on multiple factors. Not only do the medical personnel have to perform basic hygiene disinfectant protocols like washing their hands and wiping down tables and chairs after a patient leaves, but according to the CDC, they do all the cleaning, the packing, the monitoring of the operating room. It's so important that they keep up with everything within that room to keep from diseases and germs from coagulating and spreading to other medical staff or other patients who are coming in for a surgery. Some few examples of sterility in the operating room are surgical techs opening a glove for a surgeon to put their hand in, as touching the outside of the glove is unsterile and has to be thrown away after that. Also, the scrub techs wrapping the gown to a surgeon's back, as only the top front half of the gown is sterile according to the surgical abscess and the principles of sterile technique journal. And as long as nothing touches and it doesn't touch anything from the patient, it is safe to continue the procedure. How does sterility work in the hospital? Sterility can't just start in the operating room. How does it work? Where does it start? The instruments for different operations are vastly different, but they all must be sterile. It all starts in the decontamination area of the hospital, where these tools are being sent down to and washed with enzymatic that helps break down the blood and soft tissue that it might be left on them from previous surgeries. And according to the CDC, these personnel that are in the decontamination area must wear eye protection, head protection like scrub caps, keeping their hair up, masks, gowns, and thick rubber gloves so that the instruments cannot cut them and spread diseases to them. And then after they are washed, they are sent to the sterile processing technicians that inspect the instrument and and make sure that they're still in proper working condition before they are sent to autoclaves, a machine that steam treats every single instrument to a degree of almost 270 degrees Fahrenheit. When these supplies are cooled down, they are tested yet again to make sure that the sterility of the instruments is maintained and can be used again in surgery. A different soft supply that has to be sterile are soft supplies. These soft supplies are meant to be only used once. Once they are open, they cannot be put back, they cannot be cleaned, and they must be thrown away. It is so important that they are thrown away so that they cannot spread disease to other patients or to personnel that might handle them afterwards. In conclusion, after finding out how much having a clean and sterile environment affects hospitals and their staff, and now that we know that having a sterile operating room is key to having successful surgeries, but also maintaining a well-cleaned and sterile hospital, and having their personnel and staff and patients not get diseases is so incredibly important. Even as surgery continues, as medicine continues to progress and more robot-based surgeries are happening, healthcare will always need to maintain a sterile environment for their patients and for their own safety and for everybody's safety.